Precision medicine is an up-and-coming approach to provide medical care, and it's taking the lived experience and genetics of an individual to accurately provide personalized care for the patient. In order to devise such plans, research projects like Careful Devices are currently taking advantage of a growing interest in gathering health data through consumer technologies such as wearables and shift towards at-home medical practices such as telemedicine and e-health. Improvements upon design and implementation such as variety of use, aesthetics, and data travel can push forward impacts in a larger healthcare system. Although the aim is to foster interpretation with the aim of helping users understand themselves in different ways, it's the ambiguous feedback can conceive some difficulties at times. But this is meant to be used alongside traditional medical practice, creating opportunities to share information rather than keep it.
The aim of Ovum was to design an ovulation tracker that implicated variation in use, aesthetic, and responsibility of the data. The aimed consumer of Ovum was couples that are seeking to conceive. To implement the goals of Ovum into the actual device, designers exploited the intimacy of ovulation tracking. They designed Ovum to be interactive for both partners involved in attempted conception. Ovum uses a saliva-based tracking method and projects saliva samples onto the wall or a ceiling of the consumer's bedroom to portray a more intimate setting and avoid laboratory or a strategic atmosphere. The concept of Ovum is quite interesting. However, this seems like a concept that will likely not gain traction because there are far more accessible and easier forms of ovulation tracking. For many trying to conceive, looking at something associated with their data is not of their interest. When it comes to conception, most long for a quantified and easily understandable form of data they can easily apply to their life, like when is the most optimal time to have intercourse. One potential problem I see with Ovum is the accessibility of the product. Since the aimed consumer of this product are couples trying to conceive, it is highly likely that all the consumer wants to know is the most optimal time to have intercourse. Also, it does not seem like the developers considered how long it can take for couples to conceive. Sometimes couples try for years, which makes looking at their saliva sample unnecessary and no longer novel. This element itself makes the Ovum product a novelty item rather than a highly sought out ovulation tracker.
All of Us is a research program initiated by the NIH to encourage volunteers to share their health data to improve precise medicine. Their goal is to recruit 1 million volunteers, especially those who are underrepresented. More than 230,000 participants have enrolled, and 80% are from diverse and underrepresented rural areas. The data collected are used for biomedical research, and biological samples such as blood, urine, saliva samples are collected. In addition, data from Fitbit and EHR are also collected. Even though these data will greatly improve studies, more research will still need to be done because there is a high chance that people with rare diseases would not participate in this study because of stigma and other circumstances. I think the best way to collect data is to also recruit help from hospitals and clinics to get more holistic data.
Hi, I wanted to continue on the All of Us program. Now, the video describes how patients of completely different backgrounds and symptoms still will receive the same kind of checkup and screening today. Now, through the use of precision medicine, the All of Us program hopes to get patients personalized care for their specific needs and diseases rather than like a generic regimen. Now, with enough participants in the program, researchers can hopefully find patterns and new solutions like never thought before. Now, I believe this is a good idea to improving healthcare because they're right. For our own individual needs, we receive shockingly similar treatments. Now, the All of Us program is relatively new and participation is still required, but I believe that through personalized care is required, but we still need a means to get there, so they need as much information to get there as we can.